This is John Geaver for MedPage Today in Chicago. The issue of fatigue and resulting errors by interns and other trainees has been studied repeatedly, but relatively little attention has been paid to these issues for attending physicians. Dr. Jeffrey Rothschild of Brigham and Women's Hospital in Boston led a study published this week in the Journal of the American Medical Association, finding that attending surgeons and obstetricians' work hours by themselves don't appear to increase complication rates, but sleep deprivation does. Dr. Rothschild spoke at a press conference here organized by JAMA.
And overall, we found no significant difference in the rates of complications. It was 5.4% versus 4.9% for the total of all cases.
But there was a significant difference when it came to sleep opportunity between the nighttime and daytime procedures.
When we looked at the duration of sleep opportunities and the rate of complications, we found overall a significant difference of 6.2% versus 3.4%, which is on the right. But that's predominantly driven by surgical complications. When we look in L&D, there was very little difference, but in the surgical complications, the rate was 8.5% versus 3.1%.
Clearly, he suggested, attendings are subject to the same problems with fatigue that have affected trainees.
Let me discuss a couple of strategies that can be considered to reduce the risk of complications among fatigue physicians. Firstly, if possible, physicians could try to avoid scheduling elective procedures following overnight on-call responsibilities. Some situations, in some hospitals, they can use hospital-based physicians to cover overnight emergencies, and there are hospitals who do have hospital-based obstetricians, known as laborists, and surgeons as well. Physicians should consider canceling or postponing elective procedures when they feel the risks are high, or when the colleagues feel the risks are high and recognize one of their colleagues that maybe they are significantly fatigued. And then we want to encourage the use of teamwork. Again, when possible, try to use backups to assist or relieve a fatigued physician to possibly make that procedure safer. And while this study did not address the use of stimulants, in other settings there's good evidence that the appropriate use of caffeine does work and may be considered to be used if a physician has to perform life-saving procedures when fatigued.
Dr. Rothschild noted, however, that strategies to reduce fatigue-related errors by attendings will have to be implemented in individual hospitals. There is no national body that could issue mandates as there is for trainees' working conditions. In Chicago, I'm John Geaver, MedPage Today.